We're live.
This is a film of the Sunrise 7 introductory film for spinal stabilization and the healing of low back injuries. Sunrise 7. The first 7 exercises we're doing are going to be prone, or I should say supine position, your face up and your knees are bent. Put your hands on your stomach, and you're going to take a couple of deep breaths just to relax to start this series. So breathe in and expand your lower stomach. Breathe in a deep breath and fill up your lower abdomen. Relax and let the air out. Wobble your legs back and forth. And do another breath just like that. Nice deep breath of air in. Hold it and then release. Shaking your legs. The first exercise is marching. Put your arms by your sides. Lift your right knee up and hold it. Dorsiflexing your toe. Let it down. And then your left knee up. Squeeze it and hold it. Let it down. Right knee again. Squeeze and hold. This is a warm-up exercise to help to strengthen your stomach and your glutes. Now try to lift a little bit up now with the glute. Back down. Lift again up with the glute. Back down. We're going to do about 10 on each side. Squeeze it. This is a way of warming up the spine and starting to get flexibility in the lower back. Squeeze it and mean it. You never want to rush these exercises. Squeeze it and mean it. One more on the left. Back down. Shake your legs and breathe. Between each exercise, we're going to do 5 pelvic lifts. Dorsiflex your toes up from the mat. Squeeze your pelvis under, doing a pelvic tuck, and lift up and into parallel position from the mat. Come back down, breathe in. Breathe out, squeeze up. 2. Breath in, come down. Squeeze up, 3. Down. Squeeze up, 4. Down. One more time, 5, and hold it, squeeze it, and mean it. Come back down slowly. Toes down, relaxed. Shake your legs and breathe. Deep breath of air in, bringing the oxygen to your muscles and your back and your full spine. Relax for a moment. Second exercise, take a nice deep breath of air in. As you exhale, pull your right knee to your chest and pull it firmly against your chest and stretch your low back. All the erector spinae muscles get stretched. Breathe in, lower it slowly. Breathe out, pull the left knee to your chest. Squeeze it to your chest and feel the stretch of your low back and your glutes, your lower glutes, some of your hamstrings. Wiggle your foot if you feel like it. Breathe in, lower it. Breathe out, come with the right knee again. Go into your mind's eye and just relax and feel this good stretch, because it does feel so good. This is your personal time. Breath in, let it down. Breath out, pull it to your chest. Breath in, let it down. Breath out, right knee again. We're just going to do this 3 times. If you want to do it more, you can, but I think 3 times is efficient for stretching the spine. Breath in, breath out. Hold it in there. It's a nice passive stretch. Breathe in, let it down, keeping your knees bent. Dorsiflex your toes up from the mat, and then do your 5 pelvic tilts. Breathe in, breathe out and come up and extend. Breathe in, come down. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out and squeeze it and hold it and mean it. Come back down slowly. Shake your legs and breathe. We shake our legs and breathe and wiggle our hamstrings because it helps to relax the muscles and it won't allow you to cramp so easily when you do the shake your legs and breathe. Nice deep breaths of air. And breathe out, relax. The third exercise is crossing your right leg over your left, and we call this the sign of 4. You put your right hand on the right knee, cross your left hand over and put it on top of the right hand. And now you're going to do an isometric. Take a nice deep breath of air in and push your knee up against your hand and your hand down against your knee. Holding tight. 2. Breathe in. Hold the air in, hold tight, 2, 3, 4, 5, 6. Now breathe out, relax your left hand down and push your right hand down on your knee. So you're stretching that piriformis muscle of your right hip. Hold it for 6 seconds. Breathe in again, push your knee up against your hand, put your left hand across on top of your right hand, hold it tight, breathe in. Inhale, inhale, tighten, tighten, tighten. Breathe out and stretch it down again. The piriformis muscle is a muscle that gets very tight when you have chronic low back condition or sitting a lot. The piriformis tightens up. Breathe in one more time. Push 2, 3, 4, 5, 6. Breathe out and push down. 2, 3, 4, 5, 6. And whenever we do isometrics like that, we do 3. Okay, uncross the legs and do the left leg. Put your left hand on the left knee. Put your right hand on top of the left hand. Breathe in and do the isometric. Breathe in and push your knee up and keep your heel on the ground there, Lena. Breathe in. Push your hand down against your knees against your hands. Breathe in, keep the air in, keep the air in, keep the air in. Inhale, inhale, harder, harder, harder. Now breathe out and push it down. With the left hand only. Release the right hand and just relax. That's beautiful. Breathe in again. Push 2, 3, 4, 5, 6. Breathe out and stretch it down. 2, 3, 4, 5, 6. One more time. Breath in. This is the third time. 2, 3, 4, 5, 6. Breathe out and stretch it. And you can hold the stretch a little longer if you like. If it feels better, then hold it longer. If it's tighter, stretch it a little bit longer. Okay, breathe in and relax. Uncross the legs. Dorsiflex your toes again, and we're going to do our 5 pelvic lifts. Breathe in. As you exhale, squeeze it up, tightening your glutes and your extensor muscles of your back. Breathe in, come down. Exhale, come up. You want to always do your active motion when you exhale. Breathe in. Breathe out, squeeze it up. Breathe in. Breathe out, squeeze it up. And one more. Breathe in. Breathe out, squeeze it up and hold it for 2 seconds. 1001, 1002. Come down gently, breathe in, shake your legs and breathe to avoid your cramping. And if you start cramping on the first couple of repetitions, then just don't do any more, go to the next stretch. Just wait it out. Okay, the next exercise is another sign of 4 exercise. Cross your right over your left. And this is a very deep stretch to the piriformis. You can take your right hand now and stick it through your leg and pull the legs up and grab your shin with your hands. Both hands around the shin. Clasp your fingers. And now take a breath in and put your head back. Head back and relax. Breathe in and lean back against your head against the floor and push your knee down against your hand as you breathe in. We're doing an isometric. Breathe in. Push your head back and your knee down against your hand. Hold it. 2, 3, 4, 5, 6. Now breathe out and curl up. Squeeze it together. 2, 3, 4, 5, 6. Hold it. Breathe in. Back down again. Head back. Push your knee against your hand. Your head back against your floor. Breathe in. Hold it. 2, 3, 4, 5, 6. Breathe out. Exhale. Come up. 2, 3, 4, 5, 6. You're going to repeat it one more time. Any isometrics we do 3 times. Breath in, lean back. 2, 3, 4, 5, 6. Breathe out, come forward. 2, 3, 4, 5, 6. Lower that down slowly. Uncross your legs and just relax for a moment. If your back is too sore to do this exercise or you don't have the flexibility, then you can do a moderate an intermediate exercise that will be very helpful as well. Cross your left over your right. And for those that can do the normal, do it fine. But Elaine, if you could demonstrate on this one, pull the legs up, put your left hand under, and grab the back of your hamstring here instead of your shin. Just put both hands here, clasp. And Jack, you can do the normal if you'd like. Take a breath in and lean back. Push your hamstring against your hand there, Elena, and your head back against the floor. Breathe in and hold it. 2, 3, 4, 5, 6. Breathe out and lean forward. 2, 3, 4, 5, 6. Most people can reach their hamstrings. You can't reach your shin. Breathe in. Back. 2, 3, 4, 5, 6. Breathe out. 2, 3, 4, 5, 6. And as I promised, you want to do 3 isometrics. One more time. Breath in. 2, 3, 4, 5, 6. Breathe out. 2, 3, 4, 5, 6. Lower it down gently, using your lower abs to lower. Uncross your legs. That was beautiful. Okay, dorsiflex your toes. Put your feet a little further apart, Elena. And we're going to do our 5 pelvic lifts. Breath in. Exhale and come up. 1. Breathe in, come down. Breathe out. 2. Breathe in. Breathe out. Breathe in. And that's 4. One more time. Breath in. Breath out. Come down gently. Shake your legs and breath and breathe. The pelvic extensions lifts that we're doing there are very important for strengthening your low back muscles and your stomach muscles as well, which forms the pelvic framework and floor of your back flexibility and strength. So they're very important. By the time you get through with 7 of these exercises, you have done 35 of those reps. So it's very good repetition there for strengthening your back. Okay, the next exercise is again a sine of 4. Cross your right over your left. This adds 1 more to our sunrise 7. Actually makes it a sunrise 8. But this was added later in our sequencing, but it's for strengthening the lower abdominals, a very, very important exercise. We're going to do 10 reps on both sides. The right leg over the left, dorsiflex your left foot. Inhale, take a nice deep breath of air in. As you exhale, roll up and lift your butt a little off the ground. Hold it. Come back down and breathe in. Slowly, touch. Breathe out. 2. Breathe in slowly. Breathe out, come up. 3. Breath in. Breath out, come up. 4. And 5. Beautiful. Breathe in, lower slowly. Breathe out, come up. 6. Hold it. Come down. Come up. 7. Come down. And 8. And down slowly. That's beautiful. Let's get those lower abs up and down. 9. Breath in. And 1 more. Breath out. Hold it. Squeeze it. 2, 3. Come down slowly. Squeeze it and mean it. Okay. Uncross your legs and pat your stomach and tell it what a good stomach it is. Now, if you're not capable of doing the 10 reps, then just stop at some point during the time you have to stop and then wait for us to finish the reps and then go to the next one. So cross your left over to the right. Pull up to the, actually take a nice deep breath of air and pull your toe up, your right toe dorsiflexed. Take a deep breath of air in. Exhale and come up for the first rep. Up. 1. Breath in, come down. Up. 2. Gently. Breath in, come down. Keep going. 3. If you can't lift your gluteus off the floor, it's okay because you'll get strong enough eventually to do that. Elena's doing a wonderful job getting her glutes off the ground. And Jack is not quite as far because he has a low back problem right now, but that will increase with range of motion as soon as his back is healed. So these exercises are good. 1 more, right? Hold it. 2, 3, back down slowly. These exercises are good for whether you're just trying to warm up for a pre-athletic event, just shake your legs for a second and breathe, or whether you want to do the exercises for healing a low back injury. Doesn't matter. So again, dorsiflex your toes, breath in, breath out. Let's do our pelvic lift. 1, breath in, come down. And 2, in, 3, in, up again, 4, and 1 more up. Squeeze it up and hold it. Back down. Beautiful. Shake your legs and breathe. Absolutely outstanding set there. Those are the most wonderful lower abdominal exercises I've ever found. And they're easy to do in regards to the actual execution of it is easy, but to complete it all the way up into the flexion like Elena was doing is difficult to do until you get lower abdominal strength. So, but don't give up. The next exercise is a doctor exercise. Pull both knees up to your chest, grab your knees with your hands, and separate your legs apart. And lower your legs down so your arms are straight. And now just kind of rock back and forth a little bit, letting your legs separate. This is a really great adductor stretch. And the adductors are one of the most important muscles to get loose if you've got a low back problem, because they stop you from moving laterally in your gait if your back really hurts you. So this really helps to loosen up the back. With the arms now out at length, go ahead and pull your knees together. Breathe in, pull your knees together against a little resistance from your fingers like you're doing an isometric. Now breathe out and let them stretch again. And then rock back and forth. So that's our form of an isometric with the adductor stretch. Pull your knees together again. 2, 3, 4, 5. Breathe out and stretch them again. And rock it. I call it rock the baby here. And one more time. Breathe in, pull together. 2, 3, 4, 5. Breathe out. And rock your baby. 2, 3, 4, 5, 6. Okay, lower one leg down at a time. And dorsiflex your toes. And we're going to do that thing I promised you, the 5 pelvic lifts again. Here we go. Lift, 2, 3, come back down. 2, 3. Lift, 2, 3, back down. 2, 3. Breathe out, 2, 3. Breathe in, 2, 3. Breathe out. Breathe in. One more time. Squeeze it and mean it. Tighten it tight as you can. Come down slowly and shake your legs and breathe. You'll notice that these exercises, they need to be done slowly and deliberately. Do not try to speed them up. The last of the sunrise 7 plus 1 is both knees to the chest. And take a nice deep breath of air in and push your knees down against your hands and your head back against the floor. Breathe in. This is the isometric. Breathe out now, pull your head up if you can, and squeeze your knees to your chest and hold it for 6 seconds. 2, 3, 4, 5, 6. Breathe in, squeeze down again. Isometric, push your head against the floor. This is a full spine exercise. Breathe out, curl up. 2, 3, 4, 5, 6. One more time, breathe in. Squeeze your head down against the floor. Squeeze your knees against your hands. Exhale, come up. Stretch. 2, 3, 4, 5, 6. Beautiful. Lower your legs one at a time. And now shake your legs and breathe. We're not going to do 5 more pelvic lifts. We've already done 35. And we're going to do the ending exercise for this routine is the supine cross crawl. Supine means you're face up and you're doing a cross patterning, which helps to coordinate your brain and your whole body and strengthen you. Lift your right arm up at the same time you lift your left knee up. And then come back down. Breathe out. Now breathe in, breathe out as you come up with the opposite arm and leg. Breathe in as you lower. Breathe out. Breathe in. Breathe out. Breathe in. The left arm, the right leg. The right leg, the left arm. Opposite arm, opposite leg. So right arm, left leg. Left arm, right leg. Breathe in as you lower. Breathe out as you raise. Breathe in. Now try to raise up a little bit off the glute, going into a plank. You want to slowly raise. Don't raise right away when you start these, but after you've done about 3 or 4 of them, then start to raise up. And try to do about 10 supine cross crawls. That completes the supine part of this exercise. Okay, we're going to turn over now onto our stomachs, and we are going to do the extension exercises called the Sunset 6. We just completed all the flexion exercises. The flexion exercises are considered the Sunrise 7. The extension exercises are the Sunset 6. So place your hand on the pad and your fist on top of your hand and your chin on top of your fist. And I want you to just rock your booty back and forth and breathe in deep into your lower abs. Way deep, and breathe out and just relax and feel the joy of this exercise, because it's amazing how good it makes you feel just to relax and rock your booty. This is getting your low back ready for extension exercises and getting the range of motion that you need to have a